The broadcast is now starting. All attendees are in listen-only mode.
Hello, good evening. Welcome to tonight's webinar, The Path to USMLE Success, which is basically first stage, a really short version. Thanks for joining us. My name is Tal Lee. I am an associate clinical professor, allergy immunology, University of Louisville. But you folks know me better as the senior editor for the first stage of the USMLE Step 1, Step 2, Step 3 series. I'm also founder, chief education officer for USMLE-Rx, our question bank, and Scholar-X, our bricks. We're going to have a great, I think, webinar discussion tonight about preparing for the USMLE. With me is Sean Nanji, who's one of our advisors and also runs our Rx coach program. So, Sean, would you like to introduce yourself?
Sure thing, Dr. Lee. Sean here. Happy to be here as always on these webinars. I found them entertaining and very helpful for students. Been with Rx Coach for several years now and in medical education for over a decade. Looking forward to answering your questions and happy to be here.
Great, fantastic. Oops, I skipped a slide here. So, Sean will be here to help answer your questions. There is a question panel on the right side if you're on a PC. I think Macs as well too. If you're on a mobile device, smartphone, whatnot, it should be in the hamburger menu, I think. So feel free to ask questions, and we'll do our best to try to answer them as we during the, or he'll answer during the webinar while I'm presenting. And we also have Jeff and Louise from our community engagement team, also happy to answer questions as well. So let's just jump in. First thing I want to do is talk about relaxing. That is actually the first word in first stage for the USMLE Step 1 for the last 33 years or so. We feel it's important that you keep perspective, in how you prepare for the USMLE. And so think about it as a kind of a journey as opposed to a sprint. And so that means relaxing, centering yourself, and then really thinking about what you want out of the process. All right, so we'll talk about the exam itself, defining goals, timelines for studying, how you approach each of the subject, choosing resources, some study tips that have stood the test of time. There will be a raffle for Rx 360, which includes our question bank, our videos, our flashcards, and our bricks. At the end, you got to hang around, hopefully, to win. We'll draw the names towards the end, so you got to be present when Louise pulls your hand, your name out of that magic hat. And then we'll have a Q&A at the very end where we'd be happy to try to answer any question you've got. All right. Okay, so first what we're going to do is we're going to start with a poll question. Want to see who's out there tonight. So the first question is exactly that. Who are you? Please go ahead and vote. And then if you want, also in the question box, you can also tell us where you're from. And usually with these international presentations, we get folks from all over the place. So feel to let you know if you're local in the United States or somewhere else. Great, we got somebody from Nigeria, and New Jersey, so Philippines, Puerto Rico, Canada, Nigeria, Sudan. Okay, so I know that's going to be past midnight. I appreciate you guys coming. I know it's tough to stay up late, but thanks for coming. Jamaica, more local, Germany, Mexico, Mississippi. Okay, it's coming in too fast for me to read. Romania, Colombia, India. Okay, lots of folks out there. So welcome you all. There's lots of folks out here, literally hundreds of you guys. Iraq, Ukraine. Okay, hearts go out to you guys in the Ukraine. Hang in there. Thailand, Haiti, Peru. I know there's some stuff in Peru too. I hope things are getting better. Kenya, Kentucky. That's where I'm at. Awesome. All right. So welcome you all. This is fantastic. And let's see. Looks like most folks have voted. I'm going to share that the majority of folks, as you can see, are internationally born IMGs. We've got a lot of U.S. born as well too, and also a good chunk of allopathic and osteopathic students. All right, still coming in: Brazil, Dominica, Aruba, Guatemala, Ethiopia, Algeria, El Salvador, Bangladesh. So again, it's really an international crowd. Thank you guys all for coming in. Indonesia in the house. All right, so let me go ahead, minimize this poll here, get you back to the presentation here. So let's talk about the step one itself. This is a one-day exam. As most of you guys know, 8 hours total. There are 7 one-hour blocks, 280 questions in those 7 hours. So it works out to 40 questions per block, and then you have 45 minutes of break time. All right. Now you see how it's all distributed here. The blue blocks here are your exam blocks, and then you have this one orientation block at the very beginning. And the interesting thing about this orientation block is the same block that you get when you sign up at USMLE.org and download the software and run it. It's about 15 minutes, and so so the idea is what you should do is you should do this before you come in for the exam, because then what happens is that you can just skip in and use it to set your audio for your headset for the handful of multimedia questions, and then exit really quickly, because then you get to capture that most of that 15 minutes, and you get to start with close to an hour of break time. All right, people are still putting in where they're from. Michigan, Canada. Oh, sorry, somebody said they can't hear anything. Hopefully your audio is working. I know other people can hear me because, but anyway. So on the exam, you have really one type of question, which is single best answer. Most of them, a handful of them will have multimedia. Most of them will be case-based or problem solving. So it'll be 85–90% of the questions, and the majority of them will be multi-step reasoning. And what do I mean by multi-step reasoning? It's going to be questions where you're given a clinical scenario, and you have to integrate multiple disciplines together, like pathology, then pharmacology, pathology, genetics, or genetics and and physiology. So here's an example. A 32-year-old woman presents with a 5-day history of occasional double vision and bilateral ptosis, and the question, or what we call the lead-in, is what is the most appropriate diagnostic test? So if you pause and think about this, you realize that this is not a single step question, right? Because you've got a case here, and normally what you expect them to ask is, well, based on the case, what are you thinking? What's the diagnosis? But they're really asking what's the most appropriate diagnostic test to make the diagnosis. So to break that down, you're going to have to think, step one, what's the diagnosis? So and then step two, in step one, in this particular case, with this younger woman with these bilateral findings with the droopy eyelids and the double vision, it's likely going to be something like myasthenia gravis. You could argue for multiple sclerosis, but that tends to have more unilateral or asymmetric findings. And then, if you truly think it's multiple sclerosis, myasthenia gravis, then the most appropriate diagnostic test will be, pretty much an acetylcholinesterase inhibitor assay, antibody assay. Classically, years ago, you would also consider using edrophonium challenge, also known as the Tensilon test, which is a short-acting acetylcholinesterase inhibitor. That's mostly no longer used in the United States. It's still used, I think, in some other parts of the world. But so you go with that antibody assay. If it's multiple sclerosis, you might be doing imaging, MRI imaging, certain neurologic tests. So you can see how, based on the presumptive diagnosis, that would change, what you think about, what you think about in terms of the most appropriate diagnostic test. So you'll see 2-step questions, you'll occasionally see 3-step questions, or you'll see problem-solving questions where they'll give you some data. You need to run some very simple calculations to solve the question, particularly around something like sensitivity, specificity, or likelihood ratios. All right, so let's now talk about what an MA is, the question format itself, right? So, at the Prometric Testing Center, you're going to be at a PC, and it's going to have a pretty simple interface. You can see here, that again, here's the case, or what we call the STEM. That's the technical term. And then the question, which is the following is the most likely diagnosis, and that is the lead-in. And then you've got your choices. Typically, in minimum, you're going to have 4, but most of the time you're going to have 5 choices. Occasionally, you have 6 or 7, but 5 would be most likely. And then you will have about 15 to 25% of the time you will have, something visual, like a photomicrograph here, or a diagram, or something else. You've got your navigation on the top, on the side. You've got your all-important timer at the bottom. You'll notice that there's the block timer and the day timer as well too. While you were within the block, you can go back and change your answers to any of your questions. However, as soon as you exit the block, you cannot go back. The other thing is that if you had any time left over in your block timer when you exit it, it remains in your daytime remaining, so it adds to your break time basically, right? The other thing to notice is that you can also lock the exam if you need to go use the restroom or the facilities or anything like that, but the timer will continue to run, so just keep that in mind. All right, so let's talk about scoring and pass-failing. So obviously we all know that the exam is pass-fail. While they don't report it, the passing is now 196. Again, they're not going to report it, but beforehand it was around 230 with a standard deviation of around 20. If you look at first day 2023, we've got this data here. In terms of what's been happening with the pass rates. And what you'll notice from 2021, which is obviously the start of the pandemic, and 2021, which was in the heart of the pandemic, you can see for all groups of examinees, whether you're allopathic, osteopathic, MD student, IMG, whether you're US born or international born, everybody dropped at least a little, right? And you can see it was a little bit more, pronounced with international medical graduates. So, so this was pre-pass fail. So, potentially likely, due to the scramble with and the stress tied to the pandemic. The USMLE and the National Board of Medical Examiners just released about a week ago the 2022 data, not for everyone, but at least for everyone collectively, and then for US MD students, so the allopathic students. And what you see is we were reporting on first-time test takers, and so again, you go over here, it's this 96 number here, and you can see that 96 number continues. That's the 2021. But what you see is in 2022, this past year, it dropped. And overall, for all allopathic medical students, the MDs, it dropped to 91%, which is a pretty, unfortunately, a pretty large change. Now, for all test takers, it went from 88% to 82%. So we can imagine, even though they did not break out the data yet for osteopathic medical students and for international medical graduates, it's safe to assume that everybody else went down as well too. So they, they did, because there have been some rumors or concerns about what's been happening, they did release some information about the exam in 2022. They did say it's the exact same difficulty, exact same process. Nothing changed with regards to the various forms that they were using out there. they suspect that, again, there's some pandemic effects that's tied to it. Also, there was a lot of folks rescheduling and scheduling. So it's very difficult to compare one cohort to the previous because the whole pattern got screwed up because of COVID. The other thing that's clear, however, from talking to multiple deans, is that some students at some schools, potentially took their foot off the pedal, because they felt that because this was a pass-fail exam, they didn't have to go for a 250 anymore, so they didn't have to, read as much first aid or do as much of their Q bank or whatever they're doing to prepare for their exam, and because of that, likely what happened is those students that were close to the margin, those were the ones that potentially tipped over, because of the psychology of pass-fail. So that's my own, opinion, and based on talking to other education deans, we'll see what happens as further analysis comes out about, what's happening here. But suffice it to say, you cannot take the step 1 for granted, even though it's pass-fail. This is still a hard test. A lot of people will still fail, potentially, in the thousands. So you've got to prepare accordingly. All right. I'm going to skip this because, but other than say that there is a curve in terms of, when they used to report the score versus percentile, so in the past, the exam did top out at 270-ish. It was really hard to get a score higher than 270. So the USMLE, historically has been used as a screening tool. We think that's probably what's going to be happening with with students who are now taking the Step 2 CGA. I just want to remind you that these are the specialties that tend to use the USMLE screen tool because they're typically overwhelmed by applicants. So just keep in mind these very specialty. Aesthetic is plastic, so that's how we got the mnemonic to fit there. So now let's talk about study strategies. So there's a couple of things to keep in mind. You already know how to take standardized exams, right? If you're from the US, you've taken the MCAT, you've taken SATs, things like that. If you're international, you've taken PLABs or other types of exams. So you already have a certain set of skills and experiences that will put you in good stead. We will talk about some other evidence-based techniques later, but start from your foundation. You also need to know about this structure and characteristics of the subject. So, for example, microbiology and pharmacology, can often be studied with flashcards or tables because the cognitive framework around those subjects tends to be pretty stable. Whereas with something as physiology, it tends to be more about the relationship. So that's not going to work as well. You also need to know about the strengths and weaknesses of your curriculum, right? And then so you'll be able to supplement, any weaknesses in the curriculum with, other resources, beyond first aid, and then finally, you need to think about the time for a subject or a system, right? With pathology, you're likely going to give it a bunch of time because that's really, that's truly foundational for a lot of what you'll see on the exam. But then, if you're doing just neuroanatomy, that's just maybe a day or so, particularly in your dedicated period, if you have time between your finals, after your second year of medical school, if you're in the US or an international school that follows that type of pattern, and then taking the exam. And so that will allow you to decide whether you're going to be just doing reading, self-assessment with question banks and or you're going to be doing other things like flashcards and so forth. All right. So next, we're going to now talk about a couple of a couple of the subjects that you'll be dealing with and how to approach them. Many of you are also going to, and now you'll notice that we'll be talking about them as disciplines, and obviously a lot of you are in curriculum where it's by organ systems or some sort of integrated systems, but again, the discipline organ systems, a lot of these principles still apply, particularly across organ systems. And thematically, I'll try to hit the points that that go across organ systems. So anatomy, traditional anatomy, gross anatomy, stuff is low yield, but any anatomy that's tied to that has any type of clinical relevance, like the landmarks for that you'll be for diagnosing, appendicitis, for surgeries, traumatic injuries, like if you came into the emergency room and you had a spiral fracture, they may ask you what type of motor and sensory deficit you might have in your hand because of a particular nerve that goes through the humeral groove, right? So that's how things might show up on the boards. You will see, in addition to general anatomy type stuff, you'll see neuro and embryo, and anatomy that you do see on the boards where you need to potentially identify structures will almost always be done clinically. So that means there'll be X-rays, CTs, MRIs, or lab medicine, so EMs and photomicrographs. And then also, so that's that in biochemistry. That's going to be one of our crammable subjects, and so that's generally high. That generally has high yield areas in metabolic pathways, vitamin deficiencies. You'll notice that they'll tend to focus on regulatory enzymes that control the pathway. So think about how it shows up in disease, so pathobiochemistry. And then you also need to think about how it's used in the lab for science and also for laboratory diagnosis. So for example, know how flow cytometry works and how that might be tested on the exam. Microbiology is also crammable. We tend to think about it in microimmunology as just bacteriology, but there's so much more, including the immunology, the virology, and so forth. There tends to be a repeating cognitive framework for what they are trying to test, like associations with regards to how do you diagnose it, the bug, what are the laboratory characteristics, where does it go, how does it get there, how do you diagnose it, how do you treat it, what are the vectors, what are the reservoirs, and so forth, right? So that's what I mean by a regular recurring cognitive framework, right? On the immunology side, obviously now living in a world of COVID, you need to absolutely understand how the immune response works both in health and disease, how vaccines work, and immunodeficiencies. All right, pathology is a big topic, and for here, what's going on is you want to understand the characteristics of each of the primary diseases, and for common diseases, you'll see variations in presentation, right? So asthma is not always going to be shortness of breath and wheezing, right? It can present like cough, particularly in a pediatric population, whereas with more uncommon diseases, you will see it, you'll see more of the typical presentation. Now you'll be given data such as age, gender, ethnicity. They can be helpful, but just keep in mind the warning to you is not everything is pathognomonic, right? So, folks who are white and older can also have sarcoidosis. So it's not just black females, right? So don't rely on the typical classic presentations. You can have obviously atypical presentations. You will also need to recognize that they're not going to be using buzzwords or trigger words but they will give you the clinical description in a neutral way. You'll get the hang of that when you do hundreds, you should be doing thousands of USMLE style questions to see those presentations over and over again. With pathology, you often will see clinical images, photomicrographs, sometimes gross specimens and so forth. It's important not to look at those images first. You need to work through the STEM, the question, and so forth. If you ever go to our question lab sessions, we will teach you on using a question dissection strategy. That's also done by our RX coaches as well too. And so whatever you do, the images is typically one of the later stages in terms of using that to help solve the question. All right. Pharmacology is also crammable, along with, like I mentioned, biochemistry and microbiology, because again, of the recurring cognitive structure, that you're being tested on. For the exam, it's the prototypic drugs and the major variants that tend to be testable. They don't ever really go for obscure derivatives. You never need to know the trade names and dosages. They are not going to be, about a year ago, they stopped testing the treatments. So they're not going to say, hey, what's the best treatment for disease X? They will test you on mechanisms of toxicity, and they'll talk about class effects or class mechanisms. In first aid, we cover all these major categories. So make sure the minimum you cover this, whether it's in first aid or whatever you're studying. And then of course, because it's about management and treatment, it's going to almost always be integrated in case-based vignettes with other disciplines. All right, physiology, unlike some of these other crammable subjects, tends to be concept oriented. So for physiology, studying as a diagram can work well. So that's where you're mapping out relationships and so forth, like the hypothalamic pituitary axis and all that stuff. And so you need to know what inhibits, where all the control points are, in those relationships between all the glands. And again, it's going to be case based. All right, psychiatry tends to be a mix of various related domains like psychology, sociology, psychopharmacology. We cover, in addition to obviously things like mood disorders, there are other things like personality disorders, and that sometimes get short shrift. So I would make sure that you cover all those areas, and get our psych section tends to be pretty comprehensive, but use it as a framework for going deeper. All right, public health is a mix of biostats, traditionally biostats, ethics. More recently, we've seen more stuff with regards to healthcare delivery. It's also known as health system science, patient safety, and quality improvement. Certain areas tend to be reliable to testable, like biostats and epidemiology. Several years ago, they added doctor-patient interactions in terms of giving you scenarios, and then you have to coach. You have to be the doctor talking to the patient, and how would you talk to the patient? All right, and the responses would be in the form of a quote. All right, so that is a quick walk through all that. And by the way, I should have mentioned, all this is on our blog at firstaidteam.com. So hopefully you didn't take too many notes, because you get all these slides from our blog. I'll show you where it is after after this presentation. Before we talk about review resources, I just realized that there was another question I wanted to ask you folks. So this will be an opportunity to wake you guys up and get you a little more engaged. I want to know, when do you plan to take the exam? So I'll gather that data and then share that with everybody else here. All right. We got about a third of you who have replied. Keep it open for another 5 to 10 seconds. Once we get to maybe 2/3, all right, looks like we're almost there. Okay, we are there. Let me share. All right, so you should be seeing the data. It looks like the bulk of you folks will be taking it later this year, so in the latter half of the year, which is interesting because, in the past, particularly with US students, you'll see them, April, May, June, and also internationally as well too. But again, with COVID and travel and all that type of stuff, we can see how things are being spread out. We can see that people are preparing even for exams in 2024 or beyond. So that hats off to you. That's obviously dedication. All right, so let's resume. Now let's talk about review resources. There's a lot of stuff out there, textbooks, books, test prep books like First Aid, question banks like USMLE-Rx, videos, flashcards, digital flashcards, review courses, all kinds of apps out there. And so, in terms of picking and choosing these resources, you got to think about your limited time and your limited budget, right? So, what should you do? Well, we do have resource reviews in First Aid for the USMLE Step 1. It's at the very back. It's in section 4. We do have a more comprehensive guide on our blog at firstaidteam.com under the complimentary resources. So go there and check it out. I'll show that to you again, after the presentation. You should, and on our blog, it's free of charge. So, it's a complimentary resource for you. When you think about buying your resources, purchase them early, use them with your coursework if you can. Try not to overbuy. It will only stress you out. Everything, we live in an Amazon world, so a lot of stuff comes, even if it's a book, can come pretty quickly. And, the majority of the stuff you're going to be using anyway will be digital. And then when you are thinking about resources, you'll need to understand that, one resources may not be appropriate for all subjects or all disciplines or organ systems, right? So, do not assume that one size will fit all. You'll need to, use our guide and, the advice of your colleagues and classmates to help win along those resources. All right, so I do have another question for you, which is, what resources do you plan to use in preparing for the USMLE Step 1? So it could be none of the above or all of the above. So take a couple of seconds to think about it and let me know what you think. This one takes a little longer, so I'll open it up for about 20, 30 seconds. While you do that, I'm going to take a sip of my coffee. All right, looks like about half of you folks have voted. I'll keep it open for a couple more seconds. Once we get to about 2/3. All right, great. We are there. Let me go ahead and share the results. And as you can see, almost, virtually everybody does question banks. Most people will do review books and videos. About half of you guys are doing flashcards and gals, so a nice mix across the board of various resources. In addition, a lot of you are also using your med school class notes, syllabi, and so forth. Okay, so let's go ahead and get back to the presentation. So let's talk about some study tips. So one is, you want to develop your study plan early on. As soon as you kind of know generally when you want to take the exam. And also, when talking to other classmates and your advisors and so forth, in terms of your past history on standardized exams, and and whether you're or not for failing the exam, again, based on previous experience. So once you establish the study schedule, you should try to stick with it. You should try to integrate and apply everything as you go through. So that means, as you saw earlier, right, with multi-step questions, that's all about integration. And you saw how they wanted you to apply, even if it's anatomy, it's not gross anatomy, it's clinically relevant anatomy. That's what you need to know. Those crammable subjects that we talked about, such as biochemistry, microbiology, and pharmacology, that has recurring cognitive frameworks. While you normally don't want to cram, in maybe the week or two before, depending on how you set things up, you might want to loop back to some high yield facts in those areas, because again, they're easier to cram. Remember, obviously, crammable stuff is easier to forget, so that's why you do it, a week or two before the exam, as opposed to months before the exam. As I mentioned, if you're using class syllabi and things that are super helpful, you can relearn all that, and obviously, if you've been using resources like first aid all the way through your classes, med school, you can go back to all that as well too. In terms of making sure you can stick on schedule and minimize nasty surprises and whatnot, you do not want to overload yourself, right? So, give yourself some time, off, particularly, during a weekend. Ideally, take a day off, even per week, 1 day off per, even if you're in dedicated study periods. So make sure you get out there, exercise, be with friends, family, loved ones, that type of stuff. We talk about how you need to be relaxed and take the long view. And we do have this checklist in the front of the book that will help you with planning in the years, months, weeks, and days in advance. And if you do that, you should be able to stay on schedule. All right. I'll pause there, actually. See if Sean has anything to share. He's coached a bunch of students, and it'd be good to hear if there's more to add there. Sean?
Yeah, thank you very much, Dr. Lee. One of the things we always mention is assessments, right? Taking those assessments provided by the NBME. Students are very reluctant sometimes to take them, and they're like, oh, I want to get ready for it. I want to take my assessment when I'm ready. Remember, the assessment helps you get ready. It's a good tool to figure out what your strengths and weaknesses are, so you can plan your studying accordingly. So, don't be too scared to take one. Don't pay too much attention to that score when you get it if you're just starting off. Look at those subject areas and use that as a guide to help studying. One other thing we noticed is a lot of students, got a little complacent because they thought step one was pass fail and they were going to be, it'll be easier to pass. And unfortunately, a lot of students ended up failing. And so one of the questions I'm seeing now is, I'm an IMG, I failed step one. If I pass it now, can I still get a residency? And I think the safe answer, maybe Dr. Lee can actually, I know Dr. Lee can give us more insight on this, is, our response always is, pass step one and just raise the bar and do better on step two, because we think that that's going to be what residency programs look at to kind of have that barometer. So Dr. Lee, your thoughts on that?
Yeah, I absolutely agree. I mean, it's pass fail, right? So as long as you pass, they don't get any 3-digit score. You're on level with everybody else, and where you need to distinguish yourself is with USMLE Step 2 CK. I think the general advice for IMGs is that you do need to perform well. You should ideally aim for 80th, 85th percentile to get a score that will allow you to pass the screening process that are often put up at a number of institutions. Great. Sean, thank you so much. Appreciate that input. Let's keep going here. Now let's talk about the exam as a computerized test. Excuse me. Sorry, got a frog in my throat here. So I mentioned earlier that there is a tutorial that shows you how to use the software. There are a couple of keyboard shortcuts. Most folks don't use it, but it's still good to know about it. And the thing with questions, as you well know, is that you should be utilizing it throughout your preparation period from the very beginning if you can, as soon as you can start applying it, particularly once you start integrating concepts. And there's a lot of data and science behind that. Literally was published in the Journal of Science, where and reported in the New York Times, some years ago, where basically, when researchers assign students to studying, it turns out that students who studied by doing questions, that's called retrieval practice, they did better than people who just crammed multiple times, like this group. And even those, even when students got inferential questions, things that were a little more difficult, with retrieval practice, they were able to do better. All right, so let's talk about the computerized testing options out there. So you already know about the USMLE sample test. It's free. It's helpful for format familiarity. It's the free 120. It's not, while they updated some of the items, it's still not, I would say, quite up to date with what people are currently seeing these days on the USMLE. The CBSSA is a bit closer. It does involve some retired items from the USMLE and from shelf exams. CBSSA stands for the Comprehensive Basic Science Self-Assessment. There's about 6 or 8 forms that are out rotating every time. They're about 50 to 60 bucks. There are about 200 plus questions in them. You got a certain period of time to take all those questions, and then it'll give you a profile, a histogram in terms of your strengths and weaknesses and your probability of passing the exam. And then, of course, there's Q banks like USMLE-Rx, UWorld, Kaplan, and so forth. Those are good for practicing, studying, and they can also simulate and also give you a prediction on probability and so forth. We still will provide not just the probability, but also if in the old days what your 3-digit scale score is, because we still think that's a helpful motivator for you. You heard earlier, right, that some students or some IMGs misjudged the step 1 because they thought it was pass fail, and the only thing they had to go on was probability of passing or failing. The problem with that is that tends to be a bit of an abstract concept, whereas a 3-digit score, you kind of know what you can aim for. So we still think the 3-digit score is useful for just self-motivation, like you're still going for that 250 or whatever that is, and you're just using the number as a motivator. At the very least, hopefully it'll keep you out of trouble, in terms of, not being at risk for failing, on exam day. All right, so let's talk about research about the USMLE and what's worked and what's not. So there's a couple of studies that's been out there, and these are some of their findings. So not surprisingly, Q banks are more effective than flashcards. Flashcards are good learning resources, but they're not as effective as question banks, because question banks look like the real thing and behave like the real thing. When it was a scaled score, researchers found that it takes about 300 to 450 unique multiple choice questions to get 1 increase point on the board. So if you did all of USMLE-Rx, for example, you get something like 15 points. They found that the more questions you do, the better. The study out of University of Michigan, showed that students that did over 3,000 questions did better than students who did not. And then, interestingly enough, they found that the effect is tied to doing non-repeated questions, so unique questions. So you might have heard advice from other students, hey, do question bank X 3 times. The problem is that you get into this psychological state of familiarity, and you may get a question right, but it may not be because you actually solved the question. It may be because you've seen that question before. You might have consciously forgot it, but subconsciously you still remember it. And the reason you got the question right may not be because of you actually problem solving the questions, because you recognize a detail, like the patient wore a red shirt and then that patient had TB. So it's basically spurious associations that sometimes allow you to get certain questions right because you saw that question before, right? So again, you want to do at least 3,000 unique questions. repeating questions is okay for, just like reviewing and maybe learning some concepts, but in terms of maximizing the testing effect, you've got to do, a non-repeated question. So that's often why you want to do multiple question banks. And then lastly, first aid is useful. It's proven to actually help improve your USMLE score. Again, this is the same University of Michigan study where they found that those students who did 3 passes through first aid did better than those who did not. And so now the one thing I would say about that is that you want to do active learning. Research shows that just highlighting a book, including first aid, is not helpful because you're not actively applying the learning. But if you use, for example, first aid flashbacks, which is part of USMLE-Rx 360, which includes 15,000 flashcards that are directly tied to first aid, then that will allow you to actively apply first aid, and then up your theoretical score and make sure you pass the exam. All right. In terms of test day, you need to think about what your state of mind is going to be on that day. A lot of people will be a little nervous. You might be a little bit psyched up. So think about how much stimulant you really need for that day. You're going to be in a office building, and so it can be cold, occasionally hot, but mostly cold. So bring layered clothing to be most comfortable and then be able to shift. As I mentioned, you need to be able to dissect questions. So one of the things there's several methods out there. We have a 7-step method. Come to our question lab. We'll show it to you, or reach out to Sean about some coaching. But it does usually involve taking a look at the lead-in first, particularly if it's a long question, because you need to kind of know what you're up against, what they're really ultimately going to ask you, and then you go back to the stem into the case to kind of then pull it together, working with the end in mind. With regards to managing time, again, it's 40 questions, 60 minutes, so that's going to be 90 seconds per question. We generally advise that you try to come to an answer, whether you're sure or not, within 70 to 75 seconds. And then if you think it's solvable, if you're unsure of the answer, but you think it's solvable, you can mark that question and come back later. So when you're done with your first pass, you should have about 10 to 13 minutes left to go back and try to solve potentially the solvable questions, right? So keep that in mind. In terms of food and snacks, you're obviously not going to eat heavy. Most people just kind of snack their way through the day. And if you want to know where your energy level is to take breaks, right? Let's say it's after block number 2 or block number 3. You can try to do a full day simulation in USMLE-Rx. We can set that up for you. There's a way to set that up in the platform. That's a unique thing to our platform. And then you can then schedule in your breaks, when it comes to testing. The last thing we talk about is called the C reflex. This was a joke during my med school days, which is if you run into a question that you have no idea what it is, just pick a letter and move on. In fact, one of the skills that you need to develop is to be able to identify when you have no idea what's going on, and no amount of time is going to allow you to solve that question. So in that particular case, it's better to take the loss, guess C or B, or try to rule out a couple of easy distractors, then intelligent guess among the remainder, and then capture that time over. So if you can figure out that question is not solvable within, let's say, 20 seconds, then you can guess C and save 70 seconds or so that you can apply to another question. There's been some data out there that, well, first of all, we do know that there are experimental questions. There are questions that they use there that help with verify the psychometric integrity of the exam, that don't get scored and doesn't count towards your final scale score or your pass-fail adjective. So the other thing to think about is that if you run into something that looks impossible or looks completely whacked out, it could just be one of those experimental questions. Again, take your best guess and move on. All righty.